The data for colon cancer screening and populations of people living longer because they've been screened is pretty sound. Of all of the preventative care measures we can offer, maybe short of checking and controlling blood pressure, colon cancer screening is one of the strongest. The thing about colon cancer screening is that if there's a family history or if someone is over the age of 50, it's really important to get started early. And again, the recommendations are to start at age 50, sooner if there's a family history of colon cancer. What's satisfying about that particular strategy for me is where oftentimes cancer screening is just waiting until cancer arises and then dealing with it when we find it early. In colon cancer screening, we oftentimes can find precancerous lesions, remove them before they ever become a problem, and hence prevent colon cancer. And there aren't many things that we have that give us the ability to prevent cancer. Even wonderful things like mammography and pap smears, we're still waiting for cancerous changes to occur before we identify them, but in colon cancer screening, we really can impact how many people have to suffer with full-blown colon cancer. And so in being in the OR and taking off a large polyp and knowing that you've completely taken care of that problem, and also knowing that in 5 or 6 years that would have been a massive problem for that patient. It would have had, more likely than not, full-blown colon cancer and required surgery and either chemotherapy or other additional therapies. You get to prevent them from going through those things in their life, and that is a pretty gratifying experience. Currently, there are strategies for using flexible sigmoidoscopy and yearly occult blood testing of the stool. There are some genetic testing of the stool that can be done. My own recommendation is colonoscopy every 10 years starting at the age of 50 or earlier. But it's good to talk with your primary care provider to see which one works best for you.